Hi, I'm Dr. Lawrence Chan from Cardiac Vascular Sentral, Kuala Lumpur. This is one of Malaysia's first private specialist cardiac and vascular hospitals. Today, our topic is heart attacks and what it means. So I'll be taking questions online for this topic. Question number 1. What is a heart attack? A heart attack is a situation where one of the pipes to the heart muscle, called the coronary arteries, is blocked. This will result in no oxygen to the heart muscle, resulting in self-death. This is what doctors call a myocardial infarction. Next question. What happens to your heart during a heart attack? Well, during a heart attack, a clot forms on top of plaque. So, when a person is not very healthy, the cells develop plaque, which are cholesterol accumulations in the arteries. Occasionally, these plaques will rupture and they form an ulceration. Then blood cells are exposed to this ulcerated plaque and they will react as though that the heart is bleeding. They will try to plug the ulceration and they do that by forming a clot. However, this clot has nowhere to go. The clot will then block oxygenated flow to the cells beyond the blockage, and this will result in the cell not having oxygen and the cell will start to die. If blood flow is not restored by clot busting medication or angioplasty, this will result in cell death, otherwise, as we mentioned earlier, called myocardial infarction. The next question, who is at risk of having a heart attack? So what are the risk factors for a heart attack? If you are a male more than 45 years of age or a female more than 55 years of age or past menopause, you would be at more risk. If you have high blood pressure, if you have diabetes, or you have high LDL cholesterol level, that would increase your risk, especially if you have those conditions in combination. Of course, if you smoke cigarettes, it is a given, your risk is higher. If you do not exercise, if you are overweight, again, those will increase your risk of a heart attack. What are the symptoms of a heart attack? When a patient experiences a heart attack, the most common symptom they would have would be persistent and often severe central chest pain in the central part of their chest. Very often the pain will radiate, that means it will go up towards their jaw and perhaps to their shoulder, especially their left shoulder, and maybe even down their arm. Often this is associated with symptoms of cold sweats, nausea, maybe even giddiness, and breathlessness as well, I should say. When one experiences these symptoms and the symptoms don't go away after a few minutes, you need to get to an emergency department as soon as possible. How would a heart attack then be diagnosed by the doctors? Well, in the emergency department, the doctor will attend to you immediately and an ECG would be done. They would also take blood to test for things called cardiac enzymes. Occasionally, they would run an ultrasound of your heart called an echocardiogram, and when all of this prove or strongly suggest that you have a heart attack, the doctor will often speak to you to ask you to go for an urgent angiogram where a picture is taken of your coronary arteries to see where the blockage is. The next question, how are doctors going to treat my heart attack? Well, the doctors in the emergency department, after confirming that you have a heart attack, would immediately start you on blood thinners such as aspirin and likely with another blood thinner as well, because we often use 2 blood thinners in this setting. These blood thinners are called antiplatelets. The doctors also will try to make sure that you are as comfortable as possible, but they would have to move quickly to try to re-establish blood flow because there's a blockage is blocking oxygen to the heart muscle. So how do they do that? They might give you a clot busting medication, or even better, if the center that you are at has what we call a cath lab and they can do what we call primary angioplasty, which is ballooning, that would be the most effective way of re-establishing blood flow. How serious are heart attacks? Well, heart attacks are to be taken very seriously because people occasionally still do not survive heart attacks. Why is that so? It's because sometimes the heart attack is so large that the heart muscle starts to fail. That is one cause. Sometimes the heart attack irritates the heart muscle and the heart muscle starts to beat irregularly. That is called a heart arrhythmia. This can result in the heart stopping. Hence, it is important you get to an emergency department as soon as you can. And that's all we have time for today. Thank you once again for tuning in. I hope the advice was useful, and I hope that you will avail yourself and keep healthy. And with that, goodbye.